Hello everyone, Kent Bressler here. I want to welcome you to Kent's Kidney Stories. During our time together over these podcasts, I'd like to discuss kidney disease. I'd like to tell you about my journey as a transplant patient, but also talk about dialysis, kidney donation, and just about anything else that might be of interest. Kent's Kidney Stories, podcast endorsed and sponsored by kidneysolutions.org. Good morning, everybody. Afternoon, evening for my friends in Ireland. This is Kent Bressler, and we're going to do some podcasting this particularly great day in September. And I have really got a special guest. I say that every time, but the one gal that I've been looking forward to talking to is with me this morning. And after we have our prayer, we're gonna get into it. And like Jake says on State Farm commercials, you remember Jake from State Farm? He always says, "Here's the deal." I'll give you the deal in just a minute. Let's pray. Lord, we remember before you all of our brothers and sisters who are weighed down with suffering. Bless and guide us that your love may be reflected in our concern for the hunger, the oppressed, and the unloved. Help us to acknowledge and grow in appreciation that all people are made in your image and likeness. And dearest Lord, we would like to take a special time to ask you for a great blessing upon our nephrology nurses, our transplant nurses, and all those who are working in that kidney space right now. We know you have your arms wrapped around us, and we ask special blessings on those men and women who are working with transplant and with dialysis patients. We ask this all in your name, amen. Okay, this morning, I keep saying morning. I don't know what time it is where you are, but I'm going to tell you exactly where I'm at. And I'm tired, but I'm blessed. So this morning I have Jennifer Milton, who is the clinical assistant professor and chief administrative officer at University Transplant Center in San Antonio, Texas. She's in charge of integrating a lot of business and operational and quality improvements within the university system. And she's been the center of a lot of really great things that have happened at that institution. In her tenure, UTC's doubled in size and scope. And through a lot of innovative programs, UTC is the second largest living liver program in the United States, and the first program in the United States and second worldwide to perform paired living liver donations. That's quite a task to say that. I'm glad I'm reading slow. In exchanges of 6 months ago, and 6 months ago, UTC opened the Center for Life, which I'm going to have her talk about in a little bit. I could continue to read on and read on. This woman has been in the service to transplant patients for over 20 years. So not only does she know her business, but she can convey it to a lot of people. And I wanted her on, and I wanted to have her strut her stuff this morning. And that's exactly what we're going to do. Jennifer Milton, welcome to my podcast.
Thank you so much, Kent. It is a privilege to be on this podcast.
We've done, you've continually invited me and people at Kidney Solutions into your sphere at university, and we're very grateful for that. Our focus is the same regardless. It's patient-centered and patient-focused, and that's exactly what the program at university does. This morning, kind of give me an idea, a typical day for you at when you show up for work?
Well, when I show up to work, I would tell you I'm often facing far more than an 8-hour day. And we are such a big department. Under our umbrella are not only our transplant programs, kidney, liver, lung, but our pediatric transplant programs. We're one of the only pediatric programs doing liver transplants in this part of the state, one of 2 doing pediatric kidney transplants. And then we also have a lot of programs that focus on, I always say, the bigger part of our business is the goal to put ourselves out of business.
Exactly.
So early intervention in liver cancers, for instance, that's now the leading cause of liver transplant. We have a pulmonary hypertension and interventional pulmonary program where our goal is you never need a lung transplant, cystic fibrosis programs, and so we have just this big arsenal of expertise in caring for people at the worst of these end-stage organ failures and diseases, is focusing as much on prevention. We have a big research department where we're looking for better ways to treat patients and more access to organs. So I have so many departments, over 30 different departments, each with their own unique surgeons and physicians and specialized nurses and social workers and financial coordinators, that I have to sort of chop up my week to make sure everyone gets some undivided administrative time from me on certain days of the week. So I feel like I'm the conductor of a remarkable orchestra at University Transplant Center.
Exactly. As an RN, trying to find the time, you've done a great job with the organization. There's one thing that came upon mind about a year ago, just a little bit over a year ago. The executive order came out. President Trump signed that executive order, and it's been deemed the Advancing American Kidney Health Initiative. And the three main areas, for you folks that are listening and are unaware, there are 3 areas that it really stresses. First of all, is better diagnosis, treatment, and preventative care. Secondly, is patient choice, which always has been a penchant for me. Treatment alternatives, developing artificial kidneys, for an example. But just it's more of an opening to allow patients to make decisions for themselves. And then increasing access to kidney transplantation and really modernizing the way we allocate organs. So in that light, I know that you're very interested, and your organization adheres to this and have instituted many parts of this executive order. Can you share a little bit about that with us?
Well, I'll tell you, one of the things we're most proud of is that really kind of coincided with the executive order was Governor Abbott's appointment of our chairman of transplant, Francisco Cigarroa, as the chair of a chronic kidney disease task force for the state of Texas. That's been an exciting way to have a front seat to how Texas is going to lead the country in those different pillars that you sort of referred to in the executive order. Certainly, my work really centers on those components that are increasing access to donation, and I think we certainly, the executive order focused on chronic kidney disease and kidney transplantation. The great news is that so many of those initiatives will positively impact our patients who are waiting for livers and hearts and lungs. That's exciting to me. But when you really drill down to that third pillar, which is increasing kidney transplants, it's a bold goal. And the bold goal is to almost double the number of transplants by 2030. If you look back in our that's 10 years to double, but if you look back 10 years, we've not come close to that type of rapid and aggressive advances. So I'll tell you a few things that we're doing. And I just gave a presentation nationally, and the title of my presentation was "Steal This Idea, Please." I think it's something I love so much about working in an academic medical center, which is our goal is not just our business, but to make the world a better place. So in our efforts to increase access to transplantation, that executive order was divided into two categories. And one category was to increase living donation. And so there are a lot of things we're working on, and I'm a part of both locally and nationally to increase living donation. And we can explore any of these, but I'm just going to kind of go through them. One is I'm incredibly proud of the work of Donate Life America. We're going to launch a National Living Donor Registry in the next 6 months with the great support of the Fresenius Medical Foundation. This is a national effort to actually increase people that your organization, Kent, does such a great job with, giving people the opportunity to be an altruistic kidney donor and to nationalize that. So that's one national effort, and certainly I'm making sure that San Antonians and those in South and Central Texas waiting for a kidney are benefactors from that national initiative. At our own center, looking at the success of Kidney Solutions, John Hopkins of the national initiatives from the National Kidney Foundation, and I could go on and on with organizations, University of Alabama, who've launched donor champion programs to identify, to basically try to give everyone who needs a kidney transplant their own personal Kent Bressler, an advocate for them, somebody who can educate on their behalf and raise awareness on their behalf that they do need a kidney transplant. John Hopkins launched this pioneering program several years ago, and they proved that if you had a donor advocate, you were over 2 times more likely to get a kidney transplant. So we're launching a donor champion program, and we're incredibly excited about that. Those are some living donor initiatives. You certainly heard in my introduction, your listeners heard that we began taking a lot of those principles of kidney transplantation and making that an available resource for our liver recipients who don't have a dialysis or any artificial, mechanical ways to sustain their lives as their livers fail, like dialysis. So we were the first in the country to allow pairs who didn't match to actually swap portions of their liver, and we have saved a lot of lives that probably would have died on the waiting list without a living liver transplant, just because we were able to match them up with another pair. And Kent, I'll share with you later, next Friday night, the 25th, we're honoring the United States' first 4 patients to have put their trust in a medical team to say, hey, we think we have another way, and allow us to do a living liver paired exchange. Like you said, it's still a mouthful for me. So those are some things.
I'm going to mess it up. You do it well. Keep it up.
Well, those are the things University Transplant Center is doing on the living donation front. I think in accordance with the executive order, which really directed the country, find a way, be innovative, be different, be bold. And so we've got things that we're leading at the state level, leading at the national level, and changing every day in our program. We're doing the same thing to make a bold increase in deceased organ donation. Now, I have to say that the country is performing remarkably well. If you read the lay sort of news right now, there are a lot of criticisms, and there's some big national changes on how organ donation programs are going to be measured. That's been received with great criticism. But there have been, since 9 years in a row, 2019 was the 9th year in a row that deceased organ donation had hit a record. Every record breaking, shattering those records for 9 years in a row. That's amazing to me. I know it's still not enough, but it's been remarkable. There's been a 38% increase in donations since 2014. So we're headed in the right path. So what we've done at University Transplant Center really focuses not on the work that is done by our amazing partners, Texas Organ Sharing here in San Antonio, the Organ Donation Program, or Life Gift in Houston, South Texas, South Transplant Alliance in Dallas. They're remarkable organ donation programs. But what we've done at University is partner with the donation programs, and we opened a dedicated 13,000 square foot facility for the care of a donor after they had said yes to donation. So the work we do really starts after someone says yes. And TOSA, we opened about 188 days ago. We've had over 190 donors come through our facility. They've impacted 6,111 recipients. That includes about 190 recipients of organs. We've almost doubled the number of organs transplanted from a person who says yes, with really an incredibly innovative approach called a donor recovery center. The other things that we've done to impact living access to transplant is in South and Central Texas, we remain the only program that if you need a kidney transplant and you don't have a living donor, and if you know the average wait time for a kidney is over 4 years, and the doctors are concerned in 4 years you might not be a candidate, then you might qualify for a program we offer where we will give you a kidney from a donor that had hepatitis C. Even if you personally don't have hepatitis C, we're very fortunate that the head chief of hepatology, or chief of liver disease in our system, is a doctor named Fred Poordad. Fred Poordad is here in San Antonio at Texas Liver Institute and at University Transplant Center. And he and his partner Eric Lawitz were the two that led the efforts to discover the cure for hepatitis C. So Fred Poordad, our doctors, they put our heads together and said, you know, we have this big increase in organ donations where these young, medically healthy donors were unaware that they had hepatitis C. That unfortunately has been a tie to the opioid overdose epidemic in this country, that these people who unfortunately died through these overdoses there's almost a resurgence of hepatitis C. So the average wait for a kidney in this part of the country is over 4 years, and we have been amazed that we've been able to transplant at this point over 20 people. All have waited for a kidney less than 6 months, and we have cured their hepatitis C after the transplant. And what I'll tell you is, there's two incredible advances here. One is absolutely that those 20 people and counting every single day got a transplant of a very medically suitable kidney. We cured that virus in them, so that's a huge success. But secondly, now it's 20 and more people who aren't going to wait behind them on the waiting list, right? So
Right.
we've relieved that burden on the waiting list. And then the third most amazing thing to me is we carried that donors and their families' wishes out to the fullest. These are organs that would have been buried, and they are wonderful kidneys. They are some of the best medically viable organs you can have. And when I tell you my personal mantra is steal our idea, please. We have shared with 13 other transplant programs our admission orders, our protocols, our research to tell them to do this too. It's working, and it's working beautifully. Another thing we've begun to do in 2019 is we've really made some advances in what's called, it's another mouthful, Kent, but pulsatile perfusion. Pulsatile perfusion.
Yep.
And if you do just a quick little Google search, all of your listeners will know that there is really the next pandemic uh, before the real COVID pandemic. But the next pandemic everyone was focused on in the country was the acute and terrible rise of something called fatty liver disease.
Yep.
Researchers are working around the clock. Our colleagues at Texas Liver Institute have made amazing strides in trying to determine how many people actually have fatty liver disease, because you don't have a lot of symptoms until you have symptoms, and by then your liver's really been ravaged. Well, fatty liver disease is so prevalent that people who are dying of the traditional causes of organ donation, a car accident, or any situation where their brain went without oxygen, we're discovering at the time of their donation, they unknown to them, had a lot of fat in their liver. What happens to those donated livers is that TV version of organ donation, when you see one of these donated organs being transported in a cooler, that really happens. And our goal in doing that is to keep that organ as chilled as possible.
Yep.
To slow down the cellular metabolism so there's not cellular damage. When you chill a donated liver that has a lot of these fat cells in them, or a higher percentage of them, when you put it into the recipient, restore that warm blood flow, they can have something called an acute ischemic injury. And that's because when those cells are warming back up, the actual fatty cells go through almost a watering or a crystallization process. So those donated livers with a higher fat content, could not be transplanted into people because they couldn't tolerate that natural, that traditional system we used. We're putting those livers on a pump called a normothermic pump. We're keeping them at room temperature with a solution of donated blood and fluids going through them. And so when we put that liver in someone and connect that liver, it never has that ischemic injury. We've saved, at this point, 10 people who had no other chance to live, who were at the very sickest at the top of the waiting list, and they never, ever would have sustained an ischemic injury with a liver that was struggling to work initially because of how ill they were. And again, those were families that got the chance to carry their wishes out to the fullest through donating as many viable organs as possible. So 3 big innovations for us just in these last 2 years that our goal is for everyone in the country to adapt and do these things and to relieve the burden on the waiting list. And we think if our ideas can be taken and we can replicate those across the United States, and Kent, you come to our grand rounds, you know that we share with our community. We know that we want, right, that we're an open book as far as what we're trying and where we're innovating. We feel those are the types of things every single transplant center, every hospital leadership, these are big, bold moves for the hospital, and they are lockstep with us and making sure they're comfortable with us trying new technologies, our patients saying yes to these things. But if every transplant center can be this innovative and aggressive and take these ideas and run with it, we really might make a big dent in the executive order, and we may just double the number of transplants by 2030. I couldn't hope for anything more.
There's listening to this it amazes me, but when you kind of correlate timing, if you look at a kidney patient who has progressive kidney disease, whether it be FSGS, PKD, or there's a timing, there's an issue of where you have plenty of time if you get to it early. If you see that it's, in the early stages, if you can diagnose it, then you have time to work yourself towards transplant. In the liver situation, you don't have that orderly chance. Most of the liver folks really go progressively quicker than kidney patients. So all of these things that we look at in kidney transplantation is, let's get prepared for transplant. Let's not get prepared for dialysis. there's windows, except for acute kidney injury, where one can, find a donor. And that, preemptive transplant, and that's where I'm leading with this, to me is where it's at. We've for too long got patients as they progress, getting them ready for dialysis. There's a window of opportunity early on to find them donors or get their families involved to help find donors, or even the family donating, instead of putting on dialysis and then transplanting.
I love to hear you say that. I wish that was our walking mantra in the United States. And I think everyone who's facing dialysis needs to know, dialysis is, thank goodness for it. And like you even mentioned, our liver patients don't have it, and our heart and lungs really don't have something similar. You're either going to get a transplant or you're going to pass away.
Exactly.
But what I think kidney failure patients in the kidney disease community needs to understand is that dialysis only replaces one failure. And one of the failures when a kidney is failing, and that is the filtering. But the kidney has so many other critical components. Mm-hmm. And that every day you're on dialysis, your body is taking a toll from it in a way that is going to have a long-term health effect on you. We see it. If we transplant somebody, that's why living donation is so successful. Absolutely. It's not just because the kidney is better, it's because your own body is so much better. Absolutely. That much earlier in the process, that your long-term outcomes are going to be superior. So the filtering and the chronic changes, the buildup of the calciums and the plaques, and the stressors on your blood pressure, and the disruptions caused by the anemia related to kidney failure, all of those things we have the power to avoid. Yes. With extremely early access to transplantation. Now, I can't say that without saying the tragedy to me in chronic kidney failure is how much of it, and end-stage renal failure, not chronic kidney disease, but in end-stage renal failure, the tragedy is how much of it is preventable.
Oh, absolutely. Yeah.
And I tell the story in 1998. I was the basketball coach for Team South Carolina going to the U.S. Transplant Games. Yeah. A long time ago. You already dated me by how long I've worked in transplants. May will be 27 years in transplant. Yeah. But I was the team captain for this basketball team, and this basketball team was recognized at the Olympics, which were in Ohio that particular year, because every member on my team was related to each other.
Really?
And the heartbreaking part about that, and I remember saying to the grandfather who came, because his two sons were on there, and his grandsons and some of their cousins, they were all on this one team together, all of them with a form of kidney failure tied to their high blood pressure that ran in their family and began to impact their young boys as teenagers. And I remember going back to work to the head of my transplant program, and I said, I wonder if somebody would have set this grandfather down and said, every male in your family is going to follow your footprints. Yeah. You need to start checking their blood pressure at 17 years old. Don't let this happen. I wonder, if we treated kidney disease, hypertension, and diabetes, and the related kidney failure and kidney disease that comes with it, if we treated it like a transmissible, an infectious disease, and said, everybody's going to catch this, and threw up those red alarms when they were teenagers instead of when they were 25 and their kidneys were failing. I just wonder if, and that was 27 years ago. And here, absolutely, you can ask any transplant program, you can ask any nephrologist, nephrology nurse, how many patients in your dialysis units are first-degree relatives, and it's heartbreaking.
Oh yeah, that's even aside from PKD, just the blood pressure aspect of it.
Well, PKD is a lot harder to prevent. You can delay, but the leading cause is a kidney failure in the United States. And if we could prevent 50% of those, if only 50% of the preventable end-stage renal failure, and that is within our reach. And that is the first pillar of the executive kidney, advancing kidney health is how are we going to prevent this from happening?
Better diagnosis and treatment. Going back to our point about living donation, I think that in itself is the one part of the whole transplant process that is lagging behind now, and especially since COVID showed up. We have a tremendous decrease in the amount of donors coming forward. We've known that, and that's something that's going to have to really be addressed because, as you know, and like you said, a living donor kidney is a lot better for longevity and health than it is than a deceased kidney or being on dialysis, of course. But again, it just all goes back to prevention and early diagnosis and treatment. The old adage, if you will, of a physician saying, well, yeah, you got a little protein in your urine. We probably should, let's just watch that now. I'm not an advocate for watching. When I'm asked about that, I mention, you might want to consider getting another doctor. You want to get another opinion because watching kidney disease is not fun. It's progressive in a lot of the cases.
And my personal challenge is for those doctors to not, I agree with you completely. Don't just watch it. Let's get aggressive right now.
Start now.
Two, I think that doctor needs to say, hey, these conditions tend to run in families.
Yes.
Right? Here's what I need you to do with your children, even if those kids are 12 years old. We need to start measuring their blood pressure. You need to start tracking their creatinines. You need to start watching the protein in their urine. Their pediatrician needs to know that their uncle has kidney disease. We do a great job with this. We've improved as a country in doing this with breast cancer. We even alter when mammograms happen. Those screenings happen based on your first-degree relatives' histories. We've got to start doing that with the leading causes of kidney failure.
One of the things that I think is paramount is that the fact that kidney disease in its shape and form, especially FSGS, is a rare disease. So the physicians in the world doesn't really know about it as a disease like diabetes or hypertension. And there's many times or many instances where I've talked to people that said, gee whiz, if I'd known it was my blood pressure was the issue, I'd have done something about it. The deal is when you're told, okay, we're just going to watch this, it's not good. And it helps no one actually.
I think that a real challenge, Kent, is that that dehydration can cause a transient elevation in your creatinine, and the white coat syndrome can cause a transient elevation in your blood pressure. Yeah. And if you're only seeing a doctor once a year or worse, maybe you only get a health physical because of a new job once every 10 years, right? You feel fine. Minor changes are dismissed by primary care doctors.
Yep.
You probably fasted before. He probably said, don't eat and drink after midnight before you get your labs drawn because I'm going to check your cholesterol. And then your creatinine's 1.3 and the doctor's like, well, you didn't eat and drink the night before. But what the doctor should say is, it's probably that you didn't eat and drink before, but I'd like to have your labs repeated in 2 weeks.
Exactly.
Yeah.
Instead of saying, gee whiz, I think this is okay. We'll watch this. And 6 months later, you drift in and it's advancing.
Yeah.
And, there's a high percentage of people that don't progress to end-stage renal disease. But we worry about we worry about the smaller percentage because it represents millions of people.
Yeah. The local nonprofit, the Texas Kidney Foundation, and then the national nonprofit, National Kidney Foundation, they both embarked upon these remarkable programs where they do early screenings, and it's totally free. They go partner with some large corporations and maybe big health fairs, and you just basically go in and you get a finger stick, and that finger stick checks your creatinine. It checks, a few other parameters, and it's over 80% of otherwise totally healthy people have at least one abnormality in these screenings. And the mission behind these screenings is, these are just hidden dangers. You don't feel bad until it's too late, and you dismiss your symptoms when you do start feeling bad, distress and age and those other things. So I think we all, whether you're a person, the citizen, the government, the healthcare providers, we're failing to address this at the right times.
Yep, exactly. I have a feeling in my heart that this executive order, at least coming out of HHS and being signed, is the pension. It's a beginning of something better, and it was really gaining momentum until the pandemic came. And the pandemic's messed everything up, but we can't lose focus of that, because that individual executive order was the first, and I mean the first, legislative attempt to get kidney research and kidney care back on the front page. And that's in 50 years, mind you, not just in the last couple of years. It's been 50 long years. You take a look at that, and that's the most important thing about the executive order. It got the push going. We just need to sustain.
Yeah. I used to say when 26 years ago, when I began to do organ donation, we didn't have donation registries back then. And I always tell people that 100% of the time when I would walk in a room when someone passed away, that was my first job in donation, was being an organ donation coordinator. I would say to the family, do you know what your loved one wanted? You have an opportunity to donate organs? And I'm telling you, Ken, 100% of the time I heard, well, we never talked about it.
Oh, yeah. Oh, yes.
We now have a country where 60% of Americans with a driver's license have legally binding authorization to donate, right?
Yep.
And back then, I used to say the most important thing to happen at organ donation is when somebody that was high profile was personally impacted. And I hated to wish for that, but that's what changed the world. So Mickey Mantle needing a liver transplant. Michael Jordan had a best friend who died waiting for a transplant. I could go on and on, but you remember those big high profile cases, and that brought the country brought it into attention. So it's sad that the Health and Human Services Secretary's father was a dialysis patient, a transplant patient. But I truly believe his personal experience and then getting put into a position where he could influence policy this is upside down. This doesn't make sense. We're spending outrageous resources on a largely preventable condition, and we have to do better in transplantation and donation. So I don't know if we would have had this executive order had Secretary Azard not had a personal experience, and I'm grateful to have somebody who had a personal experience with a happy ending in a position of power to advance this executive order.
Well, that's exactly true. What you say is absolutely 100% true. Had it not been for Azar, if it had not been for HHS pushing the envelope on this, and in fact of him having his dad being on dialysis and then getting a transplant, so that he knows the ins and outs of it. In other words, if you've had it, you walk it, you know it. So the most important thing out of this whole thing is that I don't want to lose the emphasis. I don't care how we got there. That's history. But we know now that as this all changes, we've got to get refocused on this kidney initiative. Because if we don't, we lose Kidney X and all the investments in research. We're going to have trouble again. We'll be set back. We have to focus in on.
Yeah, and I will say, you cannot dismiss that we've had 9 years of record-breaking transplants and donations in the U.S. You can't dismiss groundbreaking research that has recently been released. Those things were in play before the executive order, but the executive order tied resources It tied better payment systems. It incentivized different types of care. And those are the things that accelerate the great things that were already happening. So, and I will come back to a comment you made earlier, and I just want to share, maybe this is good news, that the national data did show that for about a 4-month period of time, living donation in many parts of the country came to a grinding halt, but and deceased organ donation dropped. But amazingly, 2020 is on pace to be the 10th record-breaking year. And even just in our own of living donor transplants and deceased donor transplants. And what's really remarkable about that, and where we would have had an astounding year, is that so many deceased organ donors are incidentally found to be COVID positive and they're not able to donate. Mm-hmm. So if you look at the national data as of the end of August and you annualize it, 2020 is going to be the 10th consecutive record-breaking year. Testament to the amazing commitment of the organ donation programs, transplant centers, and regulators in the United States.
Yeah, I'm looking down the road too about where we're going. I just think it'd be a fantastic thing if we keep going, because I know that this, like you said, the finances, the money that's been put into this through this executive order is what drives kidney.
Right. And as you read the executive order, you'll see in each one of those pillars what the secretary did. I think what the secretary did when really presenting the case was, hey, here's the amazing work already happening. Look at this. Just like what we're doing here. And we said, steal this idea. There is pioneering, earth-shattering work happening across this country. And I think when you really looked at the entirety of the document, that's really what they did. Hey, look at this study. Look at this. Look at this. Look at this. Let's replicate it. Let's make this happen. So it's an incredibly exciting time to be in this field.
Well, it's very rewarding also to be able to work with the individual kidney patient. In retrospect, I'm glad I did what I did after I retired, because it's been very eye-opening to see where people go with the idea that, oh, I can't ask for somebody to donate to me. I can't ask them to do that. Right. And it boils down to the individual. You can do numbers all day long. You can talk about progress, but when it gets down to the nitty-gritty, it's that guy who has no idea how to do it, or that gal. And that's where the rubber meets the road.
And we're so grateful for Kidney Solutions. We see those patients. They're empowered. Their knowledge is so more well-rounded. We are so grateful for the work that you've been doing. And we partnered to help open a kidney transplant program in the Rio Grande Valley. And when there was no transplant program there, and this is replicated all over the United States, in large communities where there's not immediately a transplant center, that's where we need to replicate the things that you're doing at Kidney Solutions, because those patients without access, you think about San Antonio, and you have two of the not just country, but world's leading transplant centers across the street from each other.
Exactly.
The access to incredible care here. We have 3 dialysis private practices, and I always joke, I'm from South Carolina, that the number of employees in these 3 big private nephrology practices are more nephrologists than the entire state of South Carolina has. Yeah. So San Antonio has remarkable access to healthcare, and I think you personally do such an amazing job at fitting in right where we can't, or right where our resources, we can't get far enough in, to have this, organization to help patients this way. Like I said, it's making better patients, it's making better advocates, and we're really grateful.
There's a there have been a couple people that have stuck out in this last 2 years, but the ones that really stick out are the ones that really want to go the preemptive way. And I want to just go back to that just for 1 second. They had one fellow who had our card in his hand at one point in time, laid it down on his desk, and 3 months later, decided to call. And long story short, after we worked with him and worked with his 2 sisters, he was transplanted within 28 days.
Mm-hmm.
Okay, so you know that, and he never saw dialysis, never had any procedures. That is the window of opportunity that I think goes begging. I think that's where we should be, and we've gotten ourselves positioned at Kidney Solution to be that aggressive early on group. That's who we want to really see, but not give up on the dialysis patients that are out there wanting to get transplanted. So,
well, if time allows, or even if you have an interest in another podcast, I could have the staff of Donate Life America on. I'd love to tell you a lot about what we're doing at a national level.
No, absolutely, Jennifer. Listen, we can't. There's no way that we could even nick this big body of knowledge that you had and the organization had. But just the amount of information you've given now is going to give people enough time to shake their heads, and they're going to wonder. And I do want you back. I want you to bring somebody else back with you. How does that sound?
It's a deal. I think you'll be really excited about the National Living Donor Registry. Okay. I certainly think the work in the Center for Life is pioneering, and
if we focus on those two things, focus on those two things, get it prepared, and when you're ready, you tell me. We'll grab you by the arm and pull you right back into the studio. How's that sound?
Well, I will. The best thing I have found as a transplant administrator, and what I would attribute our transplant center's biggest success as, is that Dr. Segura and I, and Dr. Houff, his predecessor, and I are all committed to hiring people better than we are. So we've got some great experts that would really be able to give you some great information. But I can't. I just can't thank you enough for your passion and innovation and advocacy and the work you've done at Kidney Solutions. You're making your local transplant centers better caregivers. You're saving lives, not just the patients who go through Kidney Solutions, but who are then inspired to give back and help others. It's such a legacy, and it's been a privilege to watch you form it and grow it and be a tiny little part of it.
Well, you know what? The old adage is you can lead a horse to water and you can't make him drink. That's such an old saying, but I can tell you that you can help a person find a donor, but if you're there as a mentor when it all is done, then you've gotten something done. Finding donors that sounds like that's all we do. But we do a lot more than that. We are extended out past that, where we take care of the transplant afterwards. We want them to keep the kidney. And I look back, I was transplanted in this community 33 years ago.
Amazing.
So that, and that's how strong this community has been in the transplant world. So you get what you sow, and you're always going to be able to come upon people like you, Jennifer, who know it, walk it, talk it, and spread it. And I'll get back with you, and we'll come up with some ideas, and whatever you want to do, I'll bring it back in. I would love to do it. I think our listenership is big enough now that it makes a difference.
Yeah, we will be there with you. And I wanted to add one thing before you wrap up, and it ties into what you said. When I first started in this field, almost 27 years ago, someone taught me that it takes a special caregiver to love a kidney patient. Yeah. And part of that is because of that organic fatigue, that anemia that as your energy is sapped, mind, body, and spirit by this disease. And so what they told me is to be a great nephrology nurse, you had to do the impossible. And what you had to do was lead the horse to water and make the horse drink.
That's
And
right.
a great nephrology nurse knew how to do that. So in the spirit of the National Nephrology Nurses Week,
Yeah.
I think a big thank you, because I know you wouldn't be here, Kent, if a great nephrology and transplant nurse wasn't part of your care and doing just what I was told so many years ago, leading the horse and making it drink.
Yep. Making it and getting it ready for preparation to go ahead and take a drink. And I don't know. I can tell you, I could name names of the people, the nephrology nurses that were involved in my care early on. I'll never forget them. Because let me tell you what people don't realize about kidney disease is that although you may walk and talk and it may look like you're feeling fine, you're dying inside. That's the only thing that's similar to every patient with kidney disease. That's the only thing. So when you walk with kidney disease, you need a mentor. You need someone to do that with you because you'll always have questions and you'll always have fear. And these mentors give hope, right? That's all I'm in this for is hope. Because if you don't have any hope, where are you going to go? And there's always hope. It just needs to be portrayed. And that's where we'll leave that. Okay, you're coming back. Is that okay with you?
Anytime. I enjoyed it. You are gifted at this. It felt like we were just having another conversation in my office.
Listen, and someday we'll get where I can step in there and just talk to you. I can't wait to do it. So thank you so much. And we're going to do this again. I just want to tell all the listeners now, you've listened to quality people on these podcasts, and all of these podcasts are centered around you, patients, or somebody you love who has kidney disease. Kidney disease doesn't discriminate. All right, it's an equal employment killer. So if you want to go ahead and get more information, contact us at Kidney Solutions. We'll be happy to work with you. But most of all, I want you to remember one thing: there's always hope. As sick as you are right now, there's always hope. There's a better day coming. So rest on that and keep breathing.